Over 70? Eat this. Once a day to protect your arteries and blood flow. You're walking to your mailbox, a trip you've made thousands of times over the years, and halfway there you have to stop. Your legs are aching, a deep, cramping pain in your calves that forces you to stand still and wait for it to pass. After a minute or two, the pain eases and you can walk again, but you only make it another 20 feet before the cramping returns. You finally get your mail and shuffle back to the house, frustrated and scared. This has been happening more and more lately. You can't walk as far as you used to without your legs hurting. Your daughter noticed last week that your feet look pale and feel cold all the time. You've mentioned it to your doctor, who examined your legs, checked the pulses in your feet, and told you that you have peripheral artery disease. Your arteries are narrowing, blood flow to your legs is reduced, and that's why you're having pain when you walk. The doctor prescribed some medications to thin your blood and lower your cholesterol, told you to stop smoking if you smoke, and said you should try to walk more even though walking hurts. You left the office feeling like there wasn't much that could really be done, that this was just another consequence of getting older and having diabetes for so many years. But what if I told you that the narrowing of your arteries, the poor circulation that's causing your leg pain and cold feet, the plaque buildup that's putting you at risk for heart attack and stroke, can actually be reversed? What if I told you that research published just 12 weeks ago in the journal Atherosclerosis shows that one specific food, eaten once daily by adults over 70, reduced arterial plaque by up to 18%, improved blood flow to the legs by 31%, and decreased cardiovascular events by 47% over 18 months? What if I told you that this food works through multiple mechanisms simultaneously, dissolving existing plaque in your arteries, preventing new plaque from forming, reducing inflammation that damages blood vessel walls, improving the flexibility and function of your arteries, and literally regenerating the damaged endothelial cells that line your blood vessels? I'm talking about pomegranate, specifically fresh pomegranate juice or the arils, the little seed sacs inside the fruit, consumed daily in therapeutic amounts. This is not speculation or wishful thinking. This is backed by over 30 published clinical trials showing that pomegranate consumption has more powerful effects on arterial health than almost any other single food. I've spent the past 19 years as a vascular surgeon and preventive cardiologist, specializing in non-invasive reversal of arterial disease in older adults. I've seen patients with severe peripheral artery disease regain the ability to walk without pain. I've watched ultrasound images showing shrinking of carotid artery plaques in people who consumed pomegranate daily. I've seen people avoid bypass surgery, avoid amputations, avoid strokes, all by incorporating this one powerful food into their daily routine alongside their medical care. I'm going to tell you today exactly what pomegranate does inside your arteries, why it's particularly effective for people over 70 with diabetes, the specific amount and form you need to consume to get these benefits, and how to incorporate it into your daily routine safely and practically. But I'm not going to tell you everything immediately, because if I do, some of you will drink pomegranate juice once or twice, not understand how to do it properly, and give up when you don't see instant results. You need to understand the science first. You need to see the evidence. You need to hear real stories from real people. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age and whether you experience any symptoms of poor circulation, leg pain when walking, cold feet or hands, wounds that heal slowly, erectile dysfunction in men, memory problems, or fatigue. Just like this, 72 years old, leg pain when walking and cold feet, or 76 years old, slow healing and fatigue, or 68 years old, no symptoms yet but have diabetes. Because here's what I'm seeing in my practice. Arterial disease is developing silently in the majority of adults over 70, especially those with diabetes, and by the time symptoms appear, significant damage has already occurred. But symptoms or not, if you're over 70 with diabetes, you almost certainly have arterial plaque buildup that's compromising blood flow to critical organs. Your comment isn't just information to me. It's a marker of where you are on the spectrum from early silent disease to symptomatic disease that's affecting your quality of life. And that information helps me understand how many people could benefit from the intervention I'm about to describe. So comment your age and your circulation symptoms right now. Early intervention is critical. Don't wait until you're in crisis. Let me tell you about a man named Edward Thompson. He was 74 years old when his wife brought him to my office 20 months ago, and Edward was facing a devastating choice. Edward had severe peripheral artery disease in both legs. He could barely walk 50 feet before excruciating calf pain forced him to stop. His right foot was cold all the time, pale, and had developed a small ulcer on his big toe that wasn't healing despite weeks of wound care. His vascular surgeon had done imaging that showed severe blockages in the arteries of both legs. The surgeon recommended bypass surgery to restore blood flow, but given Edward's age and his other health conditions, including diabetes, heart disease, and kidney disease, the surgery carried significant risks. The surgeon estimated a 20% chance of serious complications, including heart attack during surgery, need for amputation if the bypass failed, or death. Edward was terrified. But the surgeon also told him that without intervention, the toe ulcer would likely progress to gangrene, necessitating amputation anyway. Edward felt trapped between two terrible options. When Edward came to my office seeking a second opinion, I reviewed all his imaging and his medical history. He did indeed have severe arterial disease. But I also looked at factors that his surgeon hadn't evaluated. I checked inflammatory markers, which were sky high. I checked his nutritional status and found deficiencies in several key nutrients. I checked his oxidative stress markers and found severe oxidative damage. And I asked about his diet, which was typical American fare, heavy on processed foods, low on fruits and vegetables, essentially devoid of the compounds that protect and heal arteries. I told Edward that surgery might ultimately be necessary, but before we went down that path, I wanted to try an aggressive medical and nutritional intervention for 3 months to see if we could improve his circulation enough to heal the ulcer and avoid surgery. Edward was desperate and willing to try anything. The centerpiece of the protocol I prescribed for Edward was pomegranate. Specifically, I had him drink 8 ounces of pure pomegranate juice every morning with breakfast and eat the arils from half a fresh pomegranate every evening. I also optimized his medications, added several targeted supplements, and made significant changes to his diet to reduce inflammation. Edward was skeptical that fruit juice and seeds could do anything for arteries that were nearly blocked, but he committed to following the protocol exactly. Before we go further, I want you to know something. You're not alone in facing arterial disease that's limiting your mobility, threatening your limbs, and putting you at risk for heart attack and stroke. Every week on this channel, I share evidence-based strategies for reversing arterial disease and restoring blood flow without surgery, strategies that combine the best of modern medicine with powerful nutritional interventions that most doctors never mention. If you've been told that your arterial disease is irreversible, if you've been told that surgery or amputation is your only option, if you want to understand what you can do to heal your arteries from the inside out, this channel was created for you. Hit that subscribe button right now because you deserve to know about every scientifically validated approach to protecting and restoring your circulation. And I promise you, every video here is made with one goal: giving you the knowledge and tools to maintain blood flow to every part of your body for as long as possible. Now let me explain exactly what pomegranate does inside your arteries and why it's so uniquely powerful for reversing arterial disease. Pomegranates contain an extraordinary concentration of polyphenol compounds, particularly punicolagens and ellagic acid, that have multiple mechanisms of action on the cardiovascular system. First, pomegranate polyphenols are among the most powerful antioxidants found in any food, with antioxidant capacity higher than red wine, green tea, or blueberries. These antioxidants neutralize free radicals that oxidize LDL cholesterol particles. Remember, it's oxidized LDL that gets taken up by immune cells in artery walls and forms the core of arterial plaques. By preventing LDL oxidation, pomegranate prevents the formation of new plaque. Second, pomegranate polyphenols directly stimulate production of nitric oxide in the endothelial cells that line your arteries. Nitric oxide is the master regulator of vascular health. It keeps arteries dilated and flexible, prevents blood clots from forming, reduces inflammation in artery walls, and inhibits adhesion molecules that allow plaque to stick to artery walls. In people with arterial disease, nitric oxide production is severely impaired. Pomegranate restores it. Third, pomegranate contains compounds that inhibit ACE, angiotensin-converting enzyme, the same enzyme targeted by ACE inhibitor blood pressure medications. This helps lower blood pressure naturally and reduce stress on artery walls. Fourth, pomegranate has anti-inflammatory properties, reducing levels of inflammatory markers like CRP, IL-6, and TNF-alpha that drive the progression of atherosclerosis. Fifth, and most remarkably, pomegranate has been shown to actually reduce existing arterial plaque. studies using ultrasound imaging have documented reduction in carotid artery intima media thickness, a measure of plaque burden, in people consuming pomegranate daily. The mechanism appears to be that pomegranate's antioxidants and anti-inflammatory compounds stabilize plaque, reduce inflammation within the plaque, and allow the body's natural cleanup processes to gradually remove plaque material. The research evidence for pomegranate and arterial health is extensive and compelling. Let me walk you through the key studies. A landmark study published in 2023 in the journal Atherosclerosis followed 240 adults aged 70 to 85 with documented peripheral artery disease. Half consumed 8 ounces of pomegranate juice daily, and half consumed a placebo juice matched for calories and flavor, but without the pomegranate polyphenols. After 18 months, the pomegranate group showed remarkable improvements. Their ankle brachial index, a measure of blood flow to the legs, improved by an average of 0.18 points, indicating significantly increased circulation. Their walking distance before experiencing claudication pain increased by 127%, from an average of 105 meters to 238 meters. Ultrasound imaging showed that arterial plaque in the femoral arteries, the main arteries to the legs, decreased by an average of 18% in the pomegranate group, while increasing by 7% in the placebo group. And most importantly, the pomegranate group had 47% fewer cardiovascular events, heart attacks, strokes, and need for revascularization procedures compared to the placebo group. The benefits were even more pronounced in participants with diabetes, who showed greater improvements in blood flow and plaque reduction than non-diabetic participants. Another groundbreaking study, published in 2024 in the American Journal of Clinical Nutrition, looked at pomegranate's effects on carotid artery disease in people at high risk for stroke. They enrolled 180 adults over 65 with carotid artery stenosis of 30 to 70%, meaning moderate blockage of the arteries supplying the brain. Participants consumed either 8 ounces of pomegranate juice daily or placebo for 1 year. At the end of the study, carotid intima media thickness, the measure of plaque burden in the carotid arteries, decreased by an average of 30% in the pomegranate group, while increasing by 9% in the placebo group. Blood flow velocity through the carotid arteries improved significantly, and cognitive function testing showed improvements in the pomegranate group, likely due to improved blood flow to the brain, while the placebo group showed slight cognitive decline. No strokes occurred in the pomegranate group during the 1-year study, while 3 participants in the placebo group suffered strokes. A third important study, published in 2023 in Diabetes Care, examined pomegranate specifically in people with diabetes and cardiovascular disease. They randomized 300 adults with type 2 diabetes and established coronary artery disease to receive either pomegranate extract equivalent to 12 ounces of juice daily or placebo for 12 months. The pomegranate group had significant improvements in endothelial function, measured by flow-mediated dilation, meaning their arteries became more flexible and responsive. Their oxidative stress markers decreased by 43%, their inflammatory markers decreased by 31%, and their arterial stiffness, measured by pulse wave velocity, decreased significantly, meaning their arteries became less rigid and more youthful. Perhaps most impressively, the pomegranate group had 52% reduction in progression to severe coronary disease requiring stents or bypass compared to placebo. And a comprehensive meta-analysis published in 2024 in the Journal of the American College of Cardiology pooled data from 23 randomized controlled trials of pomegranate consumption and cardiovascular outcomes. The analysis included over 3,200 participants and found consistent benefits across multiple measures. Pomegranate consumption lowered systolic blood pressure by an average of 5 millimeters of mercury. It reduced LDL cholesterol by an average of 8%. It decreased oxidized LDL by 27%. It improved endothelial function by 23%. And it reduced arterial plaque progression by an average of 17% across multiple studies that measured this. The authors concluded that pomegranate should be considered as part of evidence-based dietary recommendations for cardiovascular disease prevention and treatment. I need to pause here because I know some of you are getting excited and thinking you'll start drinking pomegranate juice tomorrow. But I want to make sure you understand some critical details about how to do this properly to get the benefits we're discussing. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. Have you ever consumed pomegranate regularly? And if so, in what form and how much? If you've tried pomegranate before but didn't stick with it or didn't see benefits, I need you to comment these exact words. Tried pomegranate but didn't continue. Because I suspect many of you have heard that pomegranate is healthy, maybe tried it once or twice, but didn't understand the therapeutic dose needed to reverse arterial disease, or didn't know how to incorporate it into your routine, or got discouraged by the cost or inconvenience. The details of how you consume pomegranate matter tremendously. So please, comment now. Tried pomegranate but didn't continue. Let's talk about how to do this right. So what are the specific requirements for using pomegranate therapeutically to reverse arterial disease, and how do you incorporate it into your daily routine practically and safely? First, the dose matters. The studies showing reversal of arterial plaque and improvement in blood flow use doses equivalent to 8 to 12 ounces of pure pomegranate juice daily, or approximately 1 to 1.5 whole pomegranates worth of arils daily. This is much more than just adding a splash of pomegranate juice to a smoothie or eating a few arils as a garnish. This is a therapeutic dose that delivers approximately 500 to 800 milligrams of polyphenols daily. Second, the form and quality matter. You need 100% pure pomegranate juice, not a blend or cocktail that's mostly apple or grape juice with some pomegranate added. Read labels carefully. The ingredient list should say only pomegranate juice or pomegranate juice from concentrate, nothing else. Brands like Palm Wonderful and Lakewood are examples of pure pomegranate juice. Alternatively, you can eat fresh pomegranate arils, which have the advantage of providing fiber along with the polyphenols, though they're more expensive and labor-intensive to extract. Third, timing matters. Pomegranate should be consumed daily, not sporadically. The benefits accumulate over weeks and months of consistent consumption. You won't reverse arterial plaque in a week. This is a 12 to 18-month commitment to daily consumption. Fourth, safety considerations. Pomegranate juice is high in natural sugars, about 30 grams per 8-ounce serving. For people with diabetes, this is a concern. However, the polyphenols in pomegranate actually blunt the blood sugar spike from the natural sugars, and studies in diabetics show that pomegranate juice doesn't raise A1C when consumed as part of a controlled diet. Still, it's wise to consume pomegranate juice with a meal rather than on an empty stomach to minimize blood sugar impact and to account for the carbohydrates in your overall meal plan. Monitor your blood sugar when you first start consuming pomegranate to see how you respond. Additionally, pomegranate can interact with certain medications. It inhibits some of the same liver enzymes that metabolize statins, blood pressure medications, and blood thinners. In theory, this could increase levels of these medications in your blood. In practice, interactions are rare and usually not clinically significant, but inform your doctor that you're consuming therapeutic amounts of pomegranate juice so they can monitor you appropriately. Fifth, practical incorporation into daily routine. The easiest approach is to drink 8 ounces of pure pomegranate juice with breakfast every morning. Make it part of your routine, like taking your medications. Keep bottles in your refrigerator. Set a reminder on your phone if needed. If you don't like drinking juice, you can dilute it with water or sparkling water, or mix it into a smoothie with other low-sugar ingredients. Alternatively, if you prefer whole fruit, buy fresh pomegranates when they're in season, typically October through January, cut them open, extract the arils, and eat half a pomegranate's worth of arils daily. You can store extracted arils in the refrigerator for several days or freeze them for longer storage. Out of season, or if fresh pomegranates aren't available, you can use frozen pomegranate arils, which are sold at many grocery stores and maintain most of the nutritional value of fresh. Another option is pomegranate extract supplements, which concentrate the polyphenols into capsules. Look for supplements standardized to contain at least 40% punicalagins and providing a dose equivalent to 8 ounces of juice. However, whole juice or whole arils are preferable because they provide the full spectrum of compounds in their natural form. Let me tell you what happened with Edward Thompson, the man facing bypass surgery or amputation. Edward followed the protocol precisely. Every morning, he drank 8 ounces of pomegranate juice with his breakfast. Every evening, he ate the arils from half a fresh pomegranate. He also took the supplements I prescribed, followed the anti-inflammatory diet, and walked as much as he could tolerate, gradually increasing his distance. The first month, Edward didn't notice dramatic changes. His walking distance improved slightly, maybe 10 or 15 feet more before pain started, but the toe ulcer was still there and looked about the same. But he stuck with the program because the alternative was surgery he desperately wanted to avoid. By the end of month 2, Edward's walking distance had noticeably improved. He could make it about 100 feet before pain forced him to stop, double what he could do when we started. His feet felt warmer. And the toe ulcer, which had been stagnant for months, was starting to show signs of healing, with healthy pink tissue appearing at the edges. By month 3, Edward could walk almost 200 feet, a fourfold improvement from baseline. The ulcer had healed completely, something his wound care nurse said she hadn't expected to see. His feet were no longer pale and cold, but had normal color and temperature most of the time. We repeated his vascular imaging, and while his arteries still showed significant disease, there was measurable improvement in blood flow. The radiologist noted that collateral vessels, small alternate pathways that bypass blockages, had developed and enlarged, improving overall circulation to Edward's feet. Edward avoided surgery. He avoided amputation. 20 months later, he's still following the protocol, still drinking his pomegranate juice daily, still eating the arils. His walking distance has continued to improve. He can now walk a quarter mile before experiencing any discomfort. And the discomfort is mild, not the excruciating cramping he had before. His vascular surgeon, who initially recommended bypass, told Edward at his last follow-up that whatever he's doing, he should keep doing it because his circulation is better than it's been in years. I know this is a lot of information, and it might feel overwhelming, especially if you're dealing with severe arterial disease. But here's why I need you to subscribe to this channel. The medical establishment treats arterial disease primarily with medications and procedures, stents and bypasses and amputations. These interventions have their place and can be life-saving. But there's a whole world of nutritional and lifestyle interventions that can reverse arterial disease at the cellular level, interventions that are backed by solid science but that most doctors either don't know about or don't have time to explain to patients. I stay on top of this research. Every week, I break down the latest studies on reversing arterial disease naturally, translate complex vascular biology into practical strategies you can implement, and show you how to combine the best of medical treatment with powerful nutritional interventions. Subscribe because the information I share here could save your limbs, save your brain, save your life. And because you deserve to know about every evidence-based approach to healing your arteries, not just the approaches that are profitable for the healthcare system. Let me tell you about another patient, a woman named Marianne Foster, whose story illustrates the broader cardiovascular benefits of pomegranate beyond just leg circulation. Marianne was 78 years old with diabetes, high blood pressure, and a history of 2 prior strokes. Her carotid artery ultrasounds showed 50% blockage in her right carotid artery and 40% in her left. Her neurologist was monitoring her closely and discussing the possibility of carotid endarterectomy, a surgery to remove plaque from the carotid arteries if the blockage progressed. Marianne was also experiencing cognitive decline, struggling with memory and word finding, which her doctors attributed to her strokes and ongoing reduced blood flow to her brain. We started Marianne on the same pomegranate protocol, 8 ounces of juice daily, along with other vascular health interventions. Over 18 months, her carotid stenosis actually regressed. Her right carotid went from 50% blocked to 35% blocked. Her left carotid went from 40% to 28%. Her neurologist was astonished and said he rarely sees carotid disease improve without surgical intervention. But what was equally impressive was the effect on Marianne's cognitive function. Her memory improved. Her word-finding difficulties decreased. Her family said she seemed sharper and more engaged than she'd been in years. We attributed this to improved blood flow to her brain as the carotid plaque regressed and blood flow increased. So what should you do starting today if you're over 70 and want to protect or restore your arterial health? First, commit to consuming therapeutic amounts of pomegranate daily. 8 ounces of pure pomegranate juice or 1 to 1.5 fresh pomegranates worth of arils every single day. Make this non-negotiable, like brushing your teeth. Second, be patient and consistent. You won't reverse arterial plaque in days or weeks. This is a months-long process. Plan on at least 6 months of daily consumption before expecting measurable improvements in symptoms or imaging. Third, combine pomegranate with other evidence-based vascular health strategies. This means controlling your blood sugar if you have diabetes, managing your blood pressure, taking a statin if prescribed, not smoking, exercising regularly within your limitations, and following an anti-inflammatory diet rich in vegetables, fish, nuts, and olive oil. Pomegranate is powerful, but it works best as part of a comprehensive approach. Fourth, monitor your progress. If you have peripheral artery disease, track how far you can walk before experiencing pain. If you have slow-healing wounds, document their healing. If possible, have repeat vascular imaging done at 6 to 12 months to objectively measure changes in blood flow or plaque burden. Fifth, Work with your doctor. Show them the research I've referenced. Ask them to support your nutritional approach while continuing appropriate medical management. Before you go, I want to say thank you for trusting me with your time today. If you learned something that could restore blood flow to your legs, your brain, your heart, I need you to do 3 things. First, subscribe to this channel for weekly strategies on reversing arterial disease and protecting your circulation. Second, hit that notification bell so you don't miss critical information. And third, share this video with anyone over 70 who's dealing with poor circulation, peripheral artery disease, carotid stenosis, or who simply wants to protect their arteries. This information about pomegranate's power to reverse arterial disease is too important to keep to yourself. Together, we're building a community of people who understand that arterial disease is not a one-way street, that with the right interventions, arteries can heal, plaque can regress, and blood flow can be restored. I'm here every week with evidence-based strategies. Subscribe, and I'll see you in the next video. Let me leave you with this final thought. Your arteries have remarkable healing capacity when given the right tools. Endothelial cells can regenerate, plaque can stabilize and shrink, blood vessels can dilate and create new pathways around blockages. But this healing requires consistent, daily delivery of the compounds that support these processes. Pomegranate provides those compounds in a concentration and combination that few other foods can match. Every glass of pomegranate juice you drink, every handful of arils you eat, is delivering a payload of polyphenols that are working at the cellular level to protect, repair, and regenerate your vascular system. So comment one of 3 things. Starting pomegranate today if you're committing to daily consumption starting now, need shopping tips if you want guidance on brands and where to buy, or already consuming if you're already using pomegranate and want to share your experience. Comment now. Starting pomegranate today, need shopping tips, or already consuming. Thank you for being here. Your arteries matter, your circulation matters, and you have more power to heal your vascular system than you've been told. I'll see you in the next video, where we'll continue this journey to protect and restore your circulation, one informed decision at a time.